Hi, my name is Robin, and I work as a Pharmaceutical Sales Representative. A typical day for me starts off at the computer. I'm focusing in on the customers that I need to see that day and the discussions that I'm going to have with them about my products. After I have mapped out my day, I head to the car. A good day for me is being able to see physicians and nurses at 5 to 6 different locations. There can be a lot of time spent waiting. I wait in the waiting room to be called back to see the doctor. I wait in the hall to see the doctor. Some days it feels like I spend more time waiting than actually having discussions with my customers. A typical discussion with a physician can last anywhere from 30 seconds to 30 minutes, depending on how busy they are. During this time, normally called detailing, it's important to point out the key points about your products. You want to find out what attributes they're looking for to better meet their needs. It usually works out that I make 2 to 3 calls before lunch and then 2 to 3 calls in the afternoon. Sometimes I have a lunch in a physician office. I either have it catered or I can pick it up myself depending on how big the office is. This time can give you great discussions with your customers, and you actually get one-on-one time with the doctors and the nurses. There are a lot of other requirements that can take you out of the field calling on customers, such as conference calls, tests, traveling to meetings out of town. Usually I have at least 1 to 2 tests a month and 2 to 3 conference calls a month. We have out-of-town meetings quarterly, but this year has been exceptionally busy, and I've been out of town at meetings just about every month. A rep is required to work 5 days a week. It's really not an 8 to 5 job. There are a lot of things that require your time after hours. There are lecture programs, and this is where you have a speaker come in and they present information about your products, and your customers, your physicians and nurses attend, and in that discussion they learn new things about your product or the disease, and you're responsible for setting up that program, getting physicians to attend that program, and making sure it's successful. You have monthly expense reports to do, as well as studying to improve your knowledge about your products and the diseases. There's also an array of data to analyze to help improve your business. Your manager rides with you once a month to evaluate your performance in the field. The stress level can get pretty high. There are a lot of things going on at one time, and you have to be able to manage it all. I sell over 8 products, and things can get sometimes overwhelming trying to keep it all together. The requirements for working as a pharmaceutical rep can vary based on the company. I'm a registered dietitian, so I do have a good science background. I train with people from various backgrounds. Some were scientific, some were not. I even had a PE teacher in my training class. You have to at least have a college degree. Having a medical background can definitely help you in the learning process, because you do learn about a lot of different diseases and things that are going on in the body. The best part about this job for me is not being confined to an office. I love being able to get out and about. I also love that I am constantly learning about new drugs, new diseases, new vaccines. Some of the diseases can be truly fascinating. It's amazing what medicines and vaccines can do for us. There is some flexibility, but not as much as some people may think. There are a lot of things that you have to get done in a day. The worst part for me is finding that work-life balance. It's easy to get consumed in all the reports and data that you have available, and you can spend hours at your computer doing reports and analyzing data instead of spending time with your family or your kids. Having your office in your home also makes it hard to cut things off. There are a lot of administrative responsibilities. My final advice would be to get to know your customers. Don't be so focused on your own objectives that you miss theirs. Building solid relationships with your customers is key. You must have good listening skills to succeed. You also have to be able to work independently.